Hi, this is Dr. Kelly Pearson, and today we're talking about cholesterol, a very confusing topic. And the truth is, in the medical literature, things take time to change, and cholesterol is one of those topics that's right in the middle of change. Let's do a quick quiz. A lot of people don't have the answers to these questions. Do we make cholesterol or do we consume most of it? What is the difference between high density and low density cholesterol? Are they good for you, or is the LDL really bad for us? Do we need cholesterol to be sane and reduce mental confusion? And lastly, do eggs increase your cholesterol? Well, here's the answer to those questions. We actually make 70% of our cholesterol in our liver. The rest of it is consumed by food, and we need desperately a certain amount of cholesterol. High density and low density lipoproteins, we'll discuss this in the second webinar on this topic, but the truth is they actually are both very healthy, and we are causing problems with LDL, and we'll unveil that surprise to you in the second section. What about cholesterol and mental clarity and sanity? The answer is no doubt about it. You need cholesterol to reduce confusion, to reduce anxiety, to reduce depression. So can you eat eggs? Actually, you can. Eggs do contain cholesterol, and we do need some cholesterol, and it's far better to eat the entire egg than just part of that egg. So what is this huge problem around cholesterol today? We know it's huge because statins, which are the drugs designed to reduce your cholesterol, by the way, they work to tell the liver not to make cholesterol, have become a multi-billion-dollar industry. And I think that what's happening today is the cause of the problem may not be as obvious as it seems. So remember when we were talking about sugar in the first module, and we said too much sugar in the system that's not being properly managed by allowing the insulin to move the sugar into the cells simply because there's too much sugar, creates that sticky reaction that causes the cholesterol actually to stick to the sides of the wall of the artery after it gets produced by the liver. So you may have an order of cholesterol for some of the neurons in your brain. Your liver dutifully makes it. It travels through the bloodstream but doesn't make it to the brain because it gets stuck to the sides of the arteries that have become sticky from the excessive sugar, which is irritating to the intima. And this results then in a plaque formation, and we know this as atherosclerosis. So what's interesting is that maybe what we should be paying attention to is not the cholesterol we're consuming, but rather the excess sugar and high glycemic foods we are ingesting to cause our arteries to be so sticky so that when we do produce the cholesterol we so desperately need, it doesn't get stuck to the walls because the walls of the artery are not irritated. So in fact, maybe what we need to do to manage cholesterol is in fact just reduce the sugar, and that will allow us to get off statins. And we see this with our patients time and time again. So the solutions to this problem always are, first and foremost, diet and exercise. We know that helps with having a healthy cardiovascular system. Supplementation from natural sources that help to reduce your cholesterol can be a benefit. We'll talk about that in an ongoing module. And then lastly, medication if all else fails, because in fact what we want to try to do for our patients is this: we don't want to do them harm, we just want to do them good, and we need to take things in a stepwise fashion. So what about this low density and high density issue? Well, we know in the body that cholesterol travels with proteins. They don't get moved around other than when they get hooked up with proteins, and hence the name lipoprotein. Cholesterol is a fat, and protein, of course, is a protein. But they both have notable value to the body. The problem is this: when low-density lipoproteins become oxidized, then they actually do become the problem the literature speaks of. They actually do cause the artery to become irritated and increase the proclivity for atherosclerosis. But if we're doing something different, then it never becomes a problem, which is the best part of this equation. So the next part of the topic, we're going to talk about oxidation. What is it, and why do we need cholesterol so badly. So I look forward to sharing that news with you in just a moment.